Yes, good evening.
Good evening, everyone, and good evening, sir. Today, I'll introduce our speaker with us, Dr. Gulab Tewani, who is currently working as Chief Medical Officer and Professor at Sant Ram Yoga and Nature Cure Hospital, India's first NABH accredited teaching hospital attached with Medical College, Sant Ram Medical College of Naturopathy and Yogic Science, Bhopal, having 10 years of experience. I welcome you, sir, on this platform. Thank you so much, sir, to come on this platform.
Thank you. Thank you. Thank you so much. Thank you. Yes, so I'll just share the screen with all.
Sure, sir.
Shall we start or wait
No,
for
no, sir. We will start, sir.
some more?
It's time, sir. 5 o'clock, sir.
Uh, Okay. Yes, this is fine.
Yes, sir.
Hope
It's
all are
visible.
able to see the screen.
Yes, sir.
Yes. So today's talk, we are going to have basically on the naturopathy principle and how these principles we are going to use in our clinical practice. So basically, if you see about the foundation of naturopathy as the unity of cure and unity of disease, we have studied, and there is only one cause of disease, and there is only one cure, which we have understood based on the traditional theories. But if I will just go with the foundations basis of naturopathy profession, we need to understand two things. One is philosophy, and the other thing is the principles. Because if we know the philosophy, then only we will adhere with the principles and adopt the principles and implement into the practice. So we have heard about the vitalism, that is the vitality. Basically, we work for the vitalism philosophy, and also the holism. Holism is the complete. We are treating the patient as a taking as a whole. We are not giving just a symptomatic relief or the only based on the symptoms. We are not treating, we are just taking all the organs together and just providing the treatment accordingly. So the vitality or vitalism is basically the originated from the American schools of naturopathy in New York, founded by Benedict Lust. And this vital force is basically the the helping in the normal functioning of the cell or the organ. Because as we know, the medical graduates, we know that cells, the one unit of cell is the structural and functional unit of the life, and the group of cells form the tissue, and group of tissues form the organ, and then the organ system. So one cell, even there is a vital force triggered to the functional normally that cell or not. So that is depending on the vital force. But when we are talking about the principles, naturopathic principles, these are the two foundations, that is the vitalism and the holism. And there are six principles which a naturopathy doctor has to follow by prior giving the treatment to the patients. Because these six principles are the foundation, and these six principles are: first, do not harm. Because based on this naturopathic principles only, we are going to treat the patient, and how we are going to implement that, we need to learn it today. So today's class, I'm really thankful to Bhavit that he has given such an opportunity to interact with the BNYS graduates, so that even they can learn with the new technology by sitting in all over India. So this basic six principles: first, do not harm; then the healing power of nature; treat the cause; treat the whole person; naturopathy doctor as a teacher; and disease prevention and health promotion. See, basically, these all six principles we have studied, but nowadays they are practicing the seventh principle, that is the wellness. So, naturopathy and yoga graduates are more into the wellness field. So that's why this sixth principle also we need to adapt, that how we are going to implement practically in our day-to-day life when we are consulting the patients and giving the treatments to them. So as the first principle, first do not do no harm. Our therapies are dedicatedly practiced to regenerate, to recuperate, not to harm. None of the therapies are going to harm on our body, that we have to adapt with this principle. And also there is a healing power in the nature itself. It is not that that something from outside is going to heal the body or heal the disease or heal the cell. It is the healing power which nature has provided us and which is present inside the body, that we need to have firm belief on it. Then treat the cause. Usually nowadays, if you will look into the practices, everybody, all the physicians, either it is naturopathy physicians or homeopathy, allopathy, anyone, they are just running behind the symptomatic relief. We don't understand why they are running behind the symptomatic relief. Why? Because see, until and unless you work on the cause, the root cause, until and unless you analyze the cause, what is the cause for this problem, you are not going to treat patient completely. You are just going to give the symptomatic relief. So that's why the third principle you need to adopt, that first you identify the root cause. I'll just give you the example like gastritis. If you find in day-to-day life lifestyle disorder like spicy food is causing the gastritis. Now apart, if you go on giving the medicines, antacids, it's not going to reduce the acidity permanently. The moment you eat spicy food, give antacid, normal. Again, moment you eat the spicy food, give antacid, normal. But until unless you remove the root cause, which is the spicy food, junk food, or fatty food, until you cut down that, you are not going to cure it completely. In naturopathy, we believe, very much we believe, the definition of cure, which is explained as per our naturopathy text. What is cure? Cure is just a readjustment from abnormal functions to normal functions. We need to readjust from abnormal functions to the normal functions. Then treat the whole person. Don't specify on one particular organ. Why? Because when the detoxification process you are going to do, when the unity of cure principle you are going to apply, at that time you need to eliminate the toxins or the end products from the body based on 4 eliminative channels. So you need to activate all that 4 eliminative channels. Then naturopathy doctor as a teacher. See, you are doctor, you are not first doctor, you are first teacher. Why? Because patient will come, he will sit with you, he will have a consultation, you will give half an hour to 45 minutes of time, which is going to make you understand what is the problem he is suffering with. What are the causes which are contributing to that person is falling ill? Because until unless you are not able to understand the causes, you are not going to resolve it. So this you need to understand. You have to behave like a teacher and then doctor. Of course, you have to give the teachings of lifestyle modifications, also the activities from morning to night, what the person has to follow in dinacharya. So dinacharya is very important. Nowadays we are not explaining dinacharya to the patient. Just patient is coming like allopathy doctor. We are just giving the prescription and sending them back to the treatment sections and giving the treatment. That is not the way of treating. If you need to adapt these principles, you need to implement into the practice. Then disease prevention and health promotion. Prevention is always better than cure. We are keep hearing about this phrase, this sentence, and until unless we believe that yes, prevention is going to help us, or give, it is better than to cure thee. So prevention, always believe that preventing any disease is a best cure. So not to get disease. How not to get disease is based on your immunity and the immune system and the resistance power what you are having, or what the individual patient is having. Based on that, you are going to decide that how many days treatments we are going to plan, and how many within how many weeks the patient is going to get recovered completely. So accordingly, you are going to do the selection also. The seventh principle is the wellness. More people, they are just adopting naturopathy because they don't want to fall ill, and as their luxury life, you can say, in most of the homes nowadays, they install steam bath, jacuzzis, and everything. So it is a part. It's going to be a part of wellness. The one thing, when the patient is coming to you, what you need to ask: my patient is permanently tired. If patient is coming and telling that I feel tiredness, you need to ask why. Patient will tell you the reason. They don't sleep well at night. Ask why. What is the reason? What is the cause? Until you are not asking this why, you are not going to get good outcome, or you can say the patient is not going to reveal you the truth why he is suffering with the disease. So you need to ask certain questions in the clinical practice, so that patient will give you the answer accordingly. Then you need to interpret that what factors are influencing on health and disease. So these are the factors which is going to affect your health status. So once you ask about the sleep pattern, they will tell, no, we are stressed or worried. Then again you ask why you are stressed, why you are worried. Patient will go on telling you, revealing you the information that the eating habits are not good. Then again ask why it is not good. At last you will come the because of stress everything is resulting. So here you can mark out that stress is the major cause of the disease. Why? Because finally you are resulting in that condition. This stress is going to affect your health status. You can result into the health and disease. As if you all are aware about the definitions which we study in our first year PNC, that is health and disease. So health is normal and harmonious vibrations, right? So vibrations are basically Pancha Mahabhutas, five elements, that is Prithvi, Aap, Tej, Vayu, Akash. If these five elements are in balanced situation, then there is a health. Opposite to the health definition, there is a disease. Disease is not merely an absence of disease, but it is an imbalance, inharmonious vibration of these elements. So if these elements are imbalanced, then the disease will result. Now, these are the factors which can make healthy person as a healthy person or the diseased person. Now, personal essence, genetics, lifestyle, social, environmental factors, external factors, physiological or medical intervention. Try to understand in the basic concept that there are antigens, there are antibodies. So one way I will give you the example. If you name the toxins, there are two types of toxins. One is exotoxins, another one is endotoxins. Exotoxins are the toxins which are coming from outside to the inside body. And endotoxins are the metabolic end products which are being generated within the body itself, but they causes toxicity. Now this toxin is basically a culprit. This is going to cause the disease. So if I will make you understand based on the naturopathy concept, you will be able to understand very easily that how these principles we can implement into the day-to-day practice. So violation of nature's law, basically violation based on the breathing, the natural living, dressing, working, resting, all these can result into the primary and secondary causes. See, everything we have studied, I am just giving you an outline to understand, to brush up your knowledge once again. And the primary causes, there are three causes: lowered vitality, abnormal composition of blood and lymph, and accumulation of morbid matter. See, when there is an depletion of vital energy or depletion of nerve energy, then only the abnormal composition of blood and lymph will result. And once the abnormal composition of blood is resulting, then the accumulation will start within the body. So the primary cause, we need to understand why the person is falling ill. The secondary causes could be heredity, pathogen, allergen, traumatic injuries, mechanical subluxations. These could be the secondary causes. But the primary cause of disease is very simple, which you need to understand. It could be lowered vitality, could be due to overwork, night work, overstimulations, or ill-advised or surgical operations. Even the abnormal composition of blood and lymph can result based on the wrong combination or improper selection of the food, or the acidic and alkaline food imbalance can also result into an abnormal composition. Whereas the third, accumulation of waste and morbid matter, can result due to your faulty food habits and also resulting due to the overeating. So this could be the secondary causes like heredity, germs, bacteria, and even the fever, inflammation, mechanical subluxations. These are the causes. So I'll just given you the outline about the causes. And yes, of course, you all are well aware with the upustry. So this is the root cause, the violation of nature's law. Once the person is violating the laws based on the ignorance or the self-control or the indifferences, this can result into the trunk, that is the primary causes, and further it can result into the diseases. So either it could be the first initial phases, there will be the acute disease, then it can result into the chronic disease. Whereas if you will try to understand the process by which diseases is caused, which was explained in Toxemia, the basic cause of disease, written by John Henry Tilden, published in 1974. The process by which the diseases are caused. So this is based on the naturopathic principles. We will just move forward also. We will just compare with the modern medicine also. So this is the stress which is resulting due to the daily habits, or it can result into the strain, then depletion of nerve energy, then also affecting all the four eliminative organs, that is lungs, bowels, kidney, and skin. When there is a depletion of nerve energy, insufficient elimination process, when toxins are going to get accumulated within the body, it will go on resulting into the toxemia. And this is the initial stage of disease called as acute and chronic crisis. We need to understand the other part of the disease formation, that is wrong eating habits can result into the acid fermentation. Also, it can result into irritation, inflammation, ulceration, and further destruction into the chronic conditions. See, these are the principles. Now we will try to understand how the cell health is important to maintain the whole body system's health. One individual cell, if one cell is healthy, your whole individual body, human body is healthy. One cell is disturbed, diseased, impaired, whole system is going to get affected. Just need to try to understand. See, I have just given you the few examples which we study in our physiology, that the lifespan of the various cells. So red blood cells every 120 days gets new, or you can say the shelf life of the RBCs are only for 120 days. The stomach cells every day change, then the skin cells every day, new skin each month will be replaced. Then liver cells every year, muscle cells rarely divide, just grow. Nerve cells rarely divide after birth. This is the lifespan. Long-lived is the smooth muscle, cardiac muscle, and the skeletal muscle, neurons. Only the smooth muscle can divide, but other cannot divide. Now, this you try to understand. This is the bone marrow. In detail, I will not go. I'll just give you the superficial, the touch of the physiology, so that we will be near around our foundation. Now, this is the bone marrow, hematopoietic stem cells, which are placed in the bone marrow. There are two classifications, that is myeloid cells and the lymphoid cells. Myeloid cells are going to form platelets, eosinophil, basophil, neutrophils, and monocytes, and also the erythrocytes. Whereas the lymphocytes, T cells, and B cells. Now, what role they are going to play based on the principles what we study. This is the example, the beautiful example for the self-healing, or body heals itself, or the healing power is in within. See, if there is a skin, a simple skin wound, if there is a small wound, it heals by itself. The system is within. The healing process take place physiologically, and which is installed by God. It is not being advised from outside. So only there is a wound. If wound is bigger, the doctor is going to put the sutures, and after closing the wound, doctor is not going to heal the internal damage of the skin. The skin cells grow by itself. The healing power of nature is going to heal this skin. You can see the healing of wound, how it is going to take place. The epidermis, dermis, if there is a wound, fibrin clot will be there, then there will be the proliferation, remodeling, and the larger the wound is going to be healed. So this is the process, how within the body it is taking place. So this is the best example for body heals itself. Now, take it the other example of the bone fracture. What doctor is going to do? Just going to provide you the rest to the bone. He's going to put the plaster of Paris for 40 days. What will happen when the doctor is providing you the plaster in the fractured bone? The bone will start growing from 0 to 3 days, 3 to 5 days, 5 to 10 days. Then finally the hard callus will be formed on 16 to 21 days, and later on it is going to heal completely. This is the best example to understand the healing power of nature. Doctor has provided plaster in order to provide you the rest. So basically the rest is curing. You are providing the rest. There is no movement. When there is no movement, this bone is healing. So rest is going to enhance the healing process. Doctor is not providing you anything, any supplement or the healing medicine. It's just giving you the supplemented food. And if diet you correct it, definitely you are also going to supplement it. But only the fractured bone is getting plaster because that bone needs a rest to get cured. Now this was this earlier I have explained you. Here you can just find out the immunity which we get it from or we get it by birth. That is the innate immunity and the adaptive immunity based on the T cells and the B cells. B cells, the lymphocytes, the plasma cells. Now here what I have focused, basically the neutrophil, eosinophil, basophil, and monocytes. They are going to work in the process of inflammation. So we need to understand what is this inflammation and what is this innate and adaptive immunity. Innate immunity, the first line defense is the skin, the mucosa, and the normal microbiota. And the second line defense is the phagocytosis, the phagocytes, neutrophils, eosinophils, inflammation, fever, and antimicrobial substances. So here inflammation you mark out. Why? Because here also we have focused here in second line defense also, because first line defense is automatically, you need not to do anything. Skin is there, it's going to protect the entry of pathogen, that it should not enter it until and unless there is an wound. But the second line defense inside the body, how this entry of pathogen is being stopped. Then adaptive immunity is the third line defense mechanism, and this is based on the T cells and the B cells. So here the second, that is the inflammation. We will just have a short brief note on inflammation. What is inflammation? See, inflammation at the root of most diseases. Try to understand. When these toxins inside the body, they are not eliminated from the body, they run through the circulation. When they run through the circulation, then these toxins will identify the weakest point of the body and get deposited in that area. if it is going to deposit into the knee joint, that is they are going to find the osteophytes. So at that level, the pain will enhance or the circulation will be altered. So try to understand there is a healing process going on in inflammation. It's not a disease condition, but it is an healing process. Body is trying to heal itself, but we are not providing an opportunity. That's why the acute reactions can convert into the chronic diseases or chronic inflammations. See, these are the all diseases which are just name it, and we very well know. You all also know that itis is going to represent the inflammation. So name it: esophagitis, sinusitis, laryngitis, pharyngitis, gastritis, osteoarthritis, anything. It is the inflammation process. Only the stages are different. That is the acute and the chronic. Now, if you will find, this is the local response of the living tissue to the injured part. Wherever there is an injury, the living tissue is putting some response based on the exogenous causes and the endogenous causes. And these are the sign of inflammation, that is the redness, swelling, pain, and heat. So this is the way of diagnosis, when the patient is coming to you and projecting the knee joint in front of you and asking, doctor, I have a lot of pain in the knee joint. So what you will do, you just see the temperature, you just see the movement, crepitus sound, and if there is a swelling, if there is redness, then you will identify, yes, there is a inflammation process going on. Now, in this healing process, what we need to do? We need to assist or we need to suppress. If you go to the doctor is prescribing you the medicine, then this process is getting suppressed. But if he is coming to a naturopath or the physiotherapist or the yoga therapist or the yoga doctor, he is just going to assist the healing process, the inflammation process. See, very well know two types, that is the acute and the chronic. If there is a stimuli, the immune helper cells do their job of healing and end the stimuli. This is the acute reaction. If you talk about the chronic inflammation, then it will ongoing process. It is an ongoing process. Repeatedly, you are getting the stimuli. When you are getting repeated stimuli, it's going to affect the joint. Why? Because you are ignoring the stimulus. You are just putting some of the painkillers. So what is happening? The repeatedly that stimuli is going to increase the cycle and pain persists for longer duration. And this longer duration is going to result into a chronic disease. Now, these are the examples of a few of the allergic reactions, chemical irritants, infections, trauma injury in the acute inflammation. Whereas the chronic inflammations, again, it will result into a chronic diseases. Now, this is about the medicine part. I will just come to the foundation of the naturopathy. See, inflammation we study in naturopathy, how it is going to affect to the healing process, that also we know very well. So let's brush up with the naturopathy inflammation, how this is going to work in our body. So basically the inflammatory process, what we believe is natural, orderly and lawful as anything else in nature. We find this as the normal procedure, and it should not be suppressed by the poisonous drugs or the surgical operations, because once if it is suppressed, then only it has an opportunity to reach further into the chronic disease. So the inflammatory process can be kept into the safe limits. These are the 5 stages: the incubation, aggravation, destruction, abatement, and reconstruction. What happens in incubation phase? Incubation is the exposure, the external, the organism or the pathogen is entering inside the body, and bodies respond to that pathogen. Is the time duration between that, it could be several hours, days, few days, months, or even years. If this is the condition, then the incubation phase progress. Now, when the phagocytes on one side and the nature's healing, the nature's antitoxins on the other hand, the poisons and microorganisms of the disease on the other hand, is going to fight in the aggravation phase. The symptom of aggravation phase is the fever. The first initial symptom based on naturopathy, we believe there is a fever. So it should reach its climax. Why? There is a fight going on between the healing process and the disease organism or the toxin. Now the destruction phase will come. In this destruction, the disease force, the force of disease and the healing force, they start fighting together. There will be some of the tissue damage, some of the cell damage, accumulation of the exudate, resulting into the abscess, boils, or fistula formation, open spores, and even these blood vessels also get destroyed in the field. This battlefield, debris of battlefield should be clear so that the abatement phase should start and reconstruction phase should come. Now, the abatement phase is only based on the lowering down temperature. Why? Because the damages what it has taken place in the destruction phase. Now, this is going to absorb from this and come into the lymphatic circulation and get eliminated from the body. Now, this destruction phase should result into the abatement phase, that is absorption and elimination of exudate, pus formation, and lowering down the temperature. So lowering down the pulse rate will take place and it will subside other symptoms of the inflammation. Then the reconstruction phase will start. In this, whatever the obstructions will be there, it will be cleared off. Work of rebuilding is going to start. Organ begins to work again. The blood vessels which was damaged will undergo repair mechanism, the healing process, and reconstruction will take place on the injured part. This is the normal procedure what we have studied. In case if there is an suppression, then there is a problem. Then the acute diseases will convert into the chronic diseases. Then we are going against to our naturopathic principles. If we are supporting that principles, we should believe there is a healing power in the nature, in the body itself. What we need to do for this? Just try to understand, should not be suppressed with the poisonous drug, should not be suppressed with the wrong treatment, should not be suppressed with any of the unnatural methods of treatment. We just need to clean this destructed cells and undergo the healing mechanism and regeneration process. But if we suppress, then what happens? If you suppress in first two stages, it will not have a fatal consequences, but yes, this will build the foundation for chronic disease. Then if you suppress the destruction phase, normal nutrition and functioning will not be able to reach to that particular cells, and this will be left out in that situation in the destructive phase and left permanently in the cell destructed region or that particular area. Then absorption phase, this symptom should get that the healing, the heating, heat, redness, swelling, and pain. These symptoms should reduce in the phase of absorption and reconstruction. Then only we will understand, yes, that there is a healing process going on. But now try to understand. If you are suppressing fourth stage and fifth stage, this will result into an chronic disease, because foundation was created in first two stages, and the chronic stage and degenerative diseases will be we will not be able to overcome with the degenerative diseases because we have suppressed last two phases. So one basic principle in naturopathy: never suppress any disease with any unnatural methods of treatment. Nature has given us 5 elements, constructed 5 elements. Use that 5 elements for the treatment. If you use that 5 elements for the treatment, you are going to overcome with the the disease with the acute phase and the chronic phase of the disease condition. The system of healing, very important to understand this. System of healing is based on our gut health, the condition of gut. If your gut is healthy, the full GI, gastrointestinal tract is healthy, digestion is healthy, assimilation, absorption, and elimination process is regular, then surely you are going to overcome with the disease condition, and this will return into a cure form, that is readjustment from abnormal functions to the normal and healthy functions. The system of healing just give rest cure, that is fasting. Fasting is the best way to provide the good rest to the internal organs, that is the physiological rest will be provided only with the fasting. And Herbert M. Shelton has very beautifully explained how fasting can save your life. Everyone should read that book because you get in-depth knowledge regarding the fasting. Then bed rest, physical and mental and physiological rest, health building principles you need to adopt. When you adopt the health building principles, the health will return. And this we can apply to so-called disease either in an acute condition or in a chronic condition, but not in the destructive conditions or the degenerative conditions. Then natural methods of treatment, very basically, beautifully explained, which can be implemented based on the naturopathic principles. Dictum of cure. What is dictum of cure? What is the cause? Remove the root cause for treating the disease. So return to nature. Our human body is being developed based on 5 elements. Use that 5 elements, Prithvi, Aap, Tej, Vayu, Akash, for healing. If you give these 5 elements, the health will return. And remove the root cause, eliminate the toxins, detoxify the body. Nowadays, detox programs are at the good demand because people are searching where they can go and detox themselves and get regenerated in some of the naturopathy hospitals. Now, these detox programs are going on. Even the supplementation of vital nutrients. If you give good nutrition, then yes, you are nourishing the cell for repair and conserve the vital energy. So don't do overexertion based on violation of nature's law. Don't violate the nature's law. If you violate the nature's law, then this is the big problem. Then you will not be able to conserve the nerve energy. And once you are not able to conserve the nerve energy, your cell health is going to be damaged. And this cell health is going to affect the system health, full health. And the 5th, very important, is the rest cure. So the best way to implement 5 principles in our day-to-day practice is RX wellness model for this basic naturopathic principles based on 5 pillars. Should have balance between the healthy spine or the nerve energy based on daily movements and proper nutrition, giving good quality of sleep by enhancing rest cure and also mental attitude. So positive mental attitude. If one person is adopting these 5 pillars of health, we are adhering to our naturopathic foundation principles, and based on that principles, this is the model which we can use it for the patients and get good results by modifying the lifestyle, by changing the dinacharya. We can overcome with the health issues. So with this, these are the 5 pillars we can use, and this is the implementation of the naturopathic principles as a clinical practice which we can see. So hope you have got completely, and at last, if you need to be healthy forever, just uproot the root cause. Don't give the symptomatic relief. Don't be afraid of diseases. only uproot the root cause with the naturopathy, the natural 5 pillars. That is the 5 pillars what I have given you. And once you are able to uproot, definitely you are going to make people more healthier, more energetic, and yes, of course, more longevity or more long live. So naturopathy is the art of living. The best way to adopt naturopathy, use these 5 pillars. This will adopt our basic 6 principles, including the seventh one, that is the wellness. You are going to fulfill based on these 5 pillars. So thank you so much. These are my references. You can refer if you need. And if any questions, I invite now. Thank you. Thank you so much.
Yes, if any questions are there, they can unmute and ask to you directly, or they can write in chat box if they have any questions. So we will wait for a minute if anyone is typing or
Yeah, yeah.
asking.
Yes.
There is a one question in the chat box.
Mhm. Yes.
Am I audible, sir?
Yes.
Yes. I'll tell.
Yes. There
From
is a
Abhishek.
question that, yeah. So obesity is an inflammatory disease, and how inflammation works in the obesity. Um, Moreover, if you will see, the obesity is the lifestyle disorder rather than going with the inflammatory disease. But yes, if you will try to understand the inflammatory disease, see what is basically happening. It is the food habit which is not correct. Based on the food habits, the lack of physical activity, and also there is a problem on the metabolism. So what being a naturopathy physician, what we are going to do, we are going to correct the metabolism by enhancing the physical activity. On other hand, we are just doing the dietary reform, restricting the calories, and also giving some of the craving in the sense like you are restricting the calories to enhance the autophagy response. Autophagy response is again the abatement phase, and the reconstruction phase is going to be activated in the inflammatory condition. So based on the naturopathic principle, I will suggest if you will go with the three things. One is correcting the metabolism by enhancing some of the physical activities, and also again giving some of the dietary reform. This is going to help us to overcome successfully on the completion of abatement and the reconstruction phase, because there was a destruction. Now destruction needs to get abatement and the reconstruction. This can be achieved in that process. So just we need to change the lifestyle for them. And the second is which was the that book on fasting which you said. Yeah, fasting can save your life. Fasting can save your life. Hubbard and Shelton. So you can refer this book. It's also available online uh, on the PDF form, or even you can get it through the Amazon. Yes. Yes. Do we have more questions?
So maybe not like they, nobody have texted anything. So I hope it's clear to everyone
Okay.
what you have covered. So, so we'll conclude the first part of this session, sir. from you, sir. So thank you so much, sir, to come on this platform and share your experience, which is very basic, but which is not followed by every doctor. So they will understand and they will learn through this process and they apply in this clinical aspect. So thank you so much.
Thank you. Thank you.
So we'll start the next session. So we'll start with next session. So good evening, sir. Am I audible to
Oh,
you?
yes, good evening.
Yes. So, good evening, everyone, and I'll introduce today's speaker with us, Dr. Narendra. He is currently working in Royal Palace, Morocco, and before he was working at Moraji Desai National Institute of Yoga, and he's the passed out student from the 13th batch of BNYS from SDM College, and he's taking today's topic, personal physician, which is very new for me also, sir, and for everyone. So thank you so much, sir, to come on this platform and have your time, sir. Thank you, sir.
Thank you. Namaste. Good evening. When Bhavit asked me that he wanted me to talk in this webinar, I was wondering, what should I say? We have amazingly talented BNYS doctors with us. They have wide range of expertise. Some are pioneer in research, some are great clinicians, some are excellent in academics, some are doing great in wellness industry. They are managers, spa managers, even the regional directors we have. They have wonderful things to say. Comparatively, I have nothing. So what should I say? It was even difficult to find the right topic of my talk yesterday when I was talking with Bhavit. But then everyone has their own journey, stories of success and failures, ups and downs, and sometimes they are worth sharing. So here I am. I am Dr. Narendra Chand. I'm from 13th batch BNYs from SDM College of Naturopathy and Yogic Sciences, Ujre. Originally, I'm from Nepal, and currently I'm working for a prominent member of Moroccan royal family since 12 years. And for next few minutes, I will be sharing my experience with this profession so far. I request all of you to listen it like a normal, non-formal conversation. Though I will be speaking most of the time, but we take it like a conversation, take it like a tea time talk with an elder brother, okay? So our community is doing commendable job by giving subject-oriented talks. I just listened to Dr. Gulab in the series of webinars. It's everywhere in the internet. They are doing the commendable job. So I do not want to give you another lecture, which is about some disease or some naturopathy topic. So it will be absolutely my perspective. So I told you I'm from 13th batch. So I'm at the point of time which you can consider the midpoint of evolution of BNYS degree. Because I'm from 13th batch, and when I look back, it's 13th batch behind me. And when I look forward, I think the batch which is coming out is 26th one. So we are at the midpoint. So I can give my perspective, even from this far, about what we are and what we can do. During the course of my talk, I will be giving 5 lessons that I have learned from my journey so far, so which may be helpful in yours too. I believe so. So I was born in a remote village in the hills of Nepal and moved to India where my father was in military. We moved back to Nepal just before my high school. So my background was non-medical. In my whole family, in the whole generation, there is nobody with the medical background, not even a lab technician or a pharmacist. So I have no idea what I wanted to do with my life. So after my school, after my college, like my plus two, with this military background, I went to Kathmandu, and there I have been trying for few things. Few things worked, things didn't work. So then, talking with few friends, then I have this first exposure of naturopathy and yoga. Before that, you will not believe that I have not even heard about this word naturopathy. I know that I knew that there were doctors of Ayurveda or even homeopathy, but I thought I was small. I thought that they are almost the same. But then when I was exposed to naturopathy and yoga, then there was a little interest of studying this. And then I found this opportunity to go to India and study this. And the seat was provided by the Indian embassy in Nepal. So I thought it's a great opportunity. So I went there. And this is the first time I went to STM college. I loved the building. I loved the atmosphere. And after a few days in first year, it was the first day when I was wearing, because the first day when you go like your casual wear. And then after a few days, they take the measurement, they give you the apron. So the first time when I was wearing this white apron, I had tears in my eyes. So nobody noticed except one of my classmates, and he was asking why. But I didn't know why, but I think it was a beginning of a journey. So, and I was thinking if my parents were there, so they would be proud to see me in this white apron. So from there, I knew that I have taken one direction, and I worked sincerely. I studied sincerely. I, I, I did all my assignments. I did everything. My teachers, they love me. I hope so. So, and the learning was a little bit difficult in those time. I'm telling, it's 2001 batch. So the internet was limited. I I remember that just for 1 hour of internet, we had to pay around 20 or 30 rupees in STM college, not our college, another one, STM college. We used to go there. We used to make a queue to take this one. And why we were going there just to listen to, just to receive the emails, and if there is something to search about, like Google. So we used to go there like once or twice in a week. So you can imagine it was difficult. It was difficult for research. Once it was Dr. Naveen, and he said that there is a lot of research, and he gave us the list, and it was like a written one. So then we have to, sometimes we have to look for the journals, we have to look in the internet, and it was, what I want to say, it was not this easy those times. But anyway, I studied, I passed with gold medal. And my first job was in a small hospital in Indian state of Uttarakhand. It was close to my home, so I took this job. And my salary was low. It was 7,000 rupees. I'm revealing it. And but when I was there, I was not really satisfied, because I was thinking it will be something different. But when you see that the things are not working according to your plan, so you keep changing. And so I moved to spa industry. So my first lesson is this one. Big journey starts with small steps. And I was willing to take the risk. I was new. I was new in the field. I had nothing to lose. Even if I change the job, if I leave in 1 month, 2 months, I have nothing to lose, because this is the time I was allowed to make mistakes. So I made my own decision, and I don't regret about it. I took challenges. I did this spa job in Nainital for a few months before moving to Agra in India. And in Agra in India, it was a big hospital, big hotel. It's a 5-star hotel. So I had more exposure. I loved it. But again, I changed in few months, and I moved to another hotel. And from there, then I got this job. It was in 2008 that I got this job. So I have been always supported by my seniors, my classmates, my colleagues, everyone. And this job was not meant to be a doctor. Originally, this job was, they just wanted some therapist. But when I see that what I can do with this job, what I can, I can prove myself with this job. So as I told, I was willing to take risk, and I didn't know even in which part of the world this Morocco is, and for what person I'm going to work. I didn't know that. I had no idea. I just left my country blindly, and I did this. So I came here, and that's how I started this job. I made my own decision, and I don't regret about it. I took challenges. I listened to my seniors. I listened to my family. But at the end, it was my decision what I was doing. So after this, I continued. But in between, when I was thinking that I'm not fulfilling what I desired to be, I wanted to do, I left the job and I went back to India. For one year and a half, around 18 months, I've been working with Morarji Desai National Institute of Yoga. But meantime, I was coming back here. I was coming back here. I was doing my old job for 1 month in a year, and then in 2011, I came back here again. And since then, I'm here all the time. So my next lesson was that there is always someone who is better than you, but you try to be the best version of yourself. And this attitude of mine helped me to stay in this job. There were, I told you, there were many ups and downs. There were many times I was lost. But I knew what I wanted. So when you are stuck in this kind of things, and when you see that somebody is trying to push you, because in like any other profession, there is always somebody behind you. They just want to push you and jump in your place. So what do? You have to prove your capability. You have to prove yourself every now and then. And then you have to prove that you are the asset and not the liability to your company or to your boss. There is tough competition, so give your best. You have to be adaptive. You have to be flexible many times to prove your worth. And that is how you are going to survive for long in any kind of profession. It's true it's any kind. There is a tough competition. But I have this very unusual career path. So that's why when in the beginning I was telling it was difficult to even define, because when somebody asks you, what do you do? For some people, it's very easy to say what they do. They say that I'm a professor, I work in this naturopathy college. I'm a doctor, I work there. But sometimes it's very difficult to define what you do, right? But how you survive is by learning. So my next lesson was never stop learning. I have been learning since my college days. Since my first anatomy class, I remember many of the things that I learned in physiology, in biochemistry, in modern diagnosis. And these subjects, they stay with you forever. I can honestly tell you there were few subjects I will not mention here, but there were few subjects I was not really, because there is something called belief. So there were few subjects I didn't have belief on. So I didn't practice that. Okay. But in few subjects I have belief, and I knew that this can be a tool, this can be an asset that I can carry throughout. So I have been learning it again and again, like anatomy, physiology, biochemistry. I have been doing lots of revision. I have been learning. I had a lot of free times with this, free times other than traveling, I should say. I've been traveling a lot, but other than traveling, whenever I have the free time, I have been doing the courses in EDX, in Coursera. Recently, I did one cognitive and behavior technique for back pain from Oxford. I did the courses in mindfulness. I did the course in pain management from NHS UK. So I have been learning, and this helps me a lot. You see, I passed like 13 years back, so a lot of things have changed. And I can tell you honestly that since the day I left STM, BNYS, CNYS, I never been back to that college. I never had the opportunity. I wish I should have gone, and I will to go back again. But what I'm saying is my exposure to academic part of naturopathy or the BNYS is nil. So I have been trying. I have been improving myself by the courses which are available online. So I have been doing that, and I have been implementing these. So you have to implement what you are learning, and you have to learn from what you are doing. Because I know that you are not just a doctor. I'm not just a doctor. What does a doctor do? Doctor sits, doctor do a diagnosis. He does a complete physical examination, and then he write the prescription. We do the same. So we are a doctor, but we are not just a doctor. We are therapists. In some settings, you don't find somebody who can do massage. You cannot find somebody who can do acupuncture on behalf of you or do other therapies. So you have to do that. So you are a therapist. You are a pharmacologist because you tell your patient that you have to add like 2 teaspoon of honey with this many milliliters of water with this drops of this extracts. You know the composition, you know the ratio. So you are a pharmacologist. You are a psychotherapist because unlike the modern doctors or the conventional doctors, you sit for hours and hours with your patient. You listen to them. You listen to their problems. You counsel them. You're a psychologist. You're a psychotherapist. You're a social worker because you do not just change the patient. You try to change their whole environment that they live, their day-to-day life. You try to modify them. You're a lifestyle modifier. So you're a social worker. You're a spiritual healer. Because why I'm saying is my perspective from the West, when they see that you do yoga, so for them, it's something spiritual also. And when you see them and when you speak with them with this spiritual touch, so you are a spiritual healer. And believe me, it works. And your knowledge, your experience, and your learning, it defines your character. And about character was my fourth lesson, which is build your character around your profession. You are called yogi, and it will be highly unacceptable if you behave in contrary. They call you yogi or the doctors, but if we are behaving just the opposite, we are not practicing what we are preaching, then there will be a lot of opposition. So you have to practice what you are preaching. So you have to build your character on your profession, because this profession, it's like a tag in your, in your forehead. You are a yoga and naturopathy doctors. So you are supposed to behave in some particular way. I'm not saying that you have to limit yourself, because everyone has their own life. Everyone has their own private life. So whatever you do in your private life, it should be something different. But what I'm saying is your interaction with your appearance in front of your patient or in your client should be something like that. Because the West view you as somebody who brought yoga. Okay, so they expect something very, very, very different from you. But then when I say about the character, so you have to respect the cultures, the tradition, the religion, the food of everyone non-judgmentally. You should not judge. We proudly say we are from Indian subcontinent, right? So you must have heard most of the time that our food is the best food in the world, but maybe you have not heard about the Mediterranean diet. The people living in Mediterranean region, they are the longest living people on the planet. Why? Because their food is something. Our food is good. Maybe there is a little bit of deviation from what our ancestors have told. That's why we are the hub of diabetes and hypertension and all the coronary heart diseases. So there is something wrong, right? So this is not the time to be proud of our food, rather than to change if there is any problem with that. So yes, you should not judge the people. You should not say that I am better than you, because when you say, just because we are from Indian subcontinent, so we know yoga better than anyone else? No. There are many people, they were doing yoga and they were studying yoga since they were small. So we don't own, we don't have the ownership of this science. This is science. This is open science. Everyone is doing this. It's the same thing like if a Chinese is thinking that acupuncture belongs to them, will you believe them? No. They will give you a very strange look. So don't give the same strange look to a Westerner when he is doing yoga, okay? So it's everyone is doing great. When I travel, so I have taken classes in New York, in Los Angeles. I have taken classes. I didn't tell them what I do. So I just go to their classes. I took the classes very silently. I try to learn. I try to learn what if there is anything different that they are doing than what we were practicing. I take them. I try to analyze it, that what is different. And if there is anything that I can take from them, I take them. You should be very open to share and learn. And we have to make a very trustworthy relationship with our client. They believe you, they trust you with their life. So we have to feel that responsibility. We have to be very honest, and we have to be very consistent on what we are doing. And then we have to prove ourselves valuable for the company and for the boss. And then I will come to my last lesson is to set your priorities right. You have to set your priorities. My priorities 10 years back will be different than now. And maybe in 10-year time, my priorities will be different. So you have to see what your priority at that particular time. Whenever you plan for something, and I think this is because the people who are already in BNYS, so they already know what is their priority, right? They have to study, they have to pass the exams, they have to pass the viva, they have to face internals and externals, which is difficult, right? But your priorities, when you come out, or even when you are intern, so we have to think what is your priority, and it can be different, and it can be changed. So there should be always not a goal, okay? There should not be a plan, but there should be a direction, because when you make plan and if it doesn't work, you may become depressed. But rather than telling it a plan or a goal, tell it a direction, because then you are more clear that, okay, I have to go on this side, okay? It happened to me many times that I was stuck. Like the first time when I was leaving any other job, I left like few jobs. But to be frank, I have left less jobs than some of my friends. So I'm in a safe position, right? So whenever I'm stuck, so what do? I make a flow chart. So for example, I want to leave this job. So I have to visualize that what are my options. My option was to go back to study, or to finish my master's, and to change my job and take another job, which I have to fix before I think I will leave this job. Okay, so when I go for this one, that I want to leave the job and I want to study. So I have to think 5 years by now. 5 years, I will finish this job, this study, this course, and where I will be. What will be my worth after 5 years if I leave this job and I go for study? Is it worth it? If I go to this job from 5 years now, where I will be, I have to visualize that. And then even if I study, I will say 2 types. Okay, because for me, I wanted to study public health and I wanted to study rehabilitation. I wanted to study neurosciences. So I think all the 3 paths, if I do this, what will happen? If I do this, what will happen? If I do this, what will happen? So I had a complete chart in front of me. This helped me to decide how I have to behave. And many times I was just crossing them. Okay, this doesn't work, this doesn't work, this doesn't work. I will go like this. Okay. And this is how I went. So I took my risks by evaluating that what I'm going to lose and what I'm going to gain. I was taking advice from my seniors. I was taking advice from my family, but they were just advising me. It was no any other influence. But I'm very fortunate to have a very supportive family, because whenever I decide something, even if I'm married now, even when I was not married, or even after my marriage. So they were very supportive of me with each of my decision. And you are the product of your own decision. So I decided many things. When I was thinking back in 2009, 9 years, that I was not doing enough here. So I left the job and I went back to Morarji Desai Institute, National Institute of Yoga. It was a very tough job. Because coming from Europe, I was going back to New Delhi, in the streets of New Delhi. I was the yoga physician for 10 of the dispensaries of CGHS dispensaries. And my senior, my officer, gave me a job to open 10 more. So you can imagine, to open 10 more, I had to visit 30 more. And I was going there all the time. I was visiting like 30 of the dispensaries, talking with the CMOs, convincing them. And in every time it was like giving an orientation to them that what we can do there. And even during this job, I was traveling like from one dispensary to another dispensary and back to Morarji Desai like once in a day. I was doing that. So it was a difficult, but I was happy. And then I decided to come back. Then again, it was the same. I visualized my plan, like where I will be. If I'm doing the same job for 10 years, where I will be. So I came back here again. And why I came back here, it was my fourth point, that you have to build your character around your profession. So maybe my character was something like that my boss, they keep calling me. They requested me to come back, so I came back. And in 2012, I had this opportunity to work for International Conference of Naturopathic Medicine. So it was the first international conference where we were successful to bring around the first time around 200 am I audible? Because I'm just keep talking. Am I audible?
Yes, sir.
Okay, perfect. So no, because when you keep talking, so we don't know. Sorry? Excuse me? Bhavit, can you please reply? Hello? Hello?
Yes, sorry, sir. You are clear, sir.
Okay, perfect. So what I was telling about, it was about ICNM. It was in 2012. So I joined ICNM, and in ICNM, it was the International Conference of Naturopathic Medicine. We were successful to bring the naturopathy doctors, around 200 from different part of 24 countries. They participated in this international conference. And we did 2 in Paris and 1 in Barcelona. And after that I left the board. I was in the organizing committee, the board. And during one of such board, I met one of such conference. I met Dr. Gulab also, although I know him before, but he came to one of them too. And in one of them, there was the formation of World Naturopathic Federation. I hope you have heard about it. It was the only one federation which connects all the naturopathy professionals in the world. So this was the product of one of the ICNM conferences. So I did few things there. I have been fortunate to meet some wonderful doctors around the world. But then I realized that it's the naturopathy, what we practice and what they practice, it's fundamentally it's a little bit different. So, but then I left because I have been traveling a lot because of my current job, and I could not keep with the changing environment and the schedules and the interviews and everything. It was a little bit difficult. Even with my further studies, I could not do many things because sometimes for the educational institutes, you have to attend the interviews, and I could not attend that. So this was my story until now. I'm here since 12 years, and it had been a great journey so far. And but this is just a journey. It's not the destination. So I'm willing to do more. So and let's see where it goes. So at the end, I just want to clear that this was absolutely my perspective, right? It's I'm not at the dusk of my career, but at least as an elder brother, if I can advise you something, if I said something that is helpful in your career, in your student life, if my words make some sense in your life, I would feel that I have not wasted your time. And so if there are any questions, so well, this was my story, so I don't think that you can question my story, right? So but still, if you have anything, if you have anything to say, if you have anything to share, so I'm open to the questions, but I request you to be in contact with your seniors, be open to networking with the seniors, the classmates. Even when you go out, be close to your classmates. That's how the thing works. I don't know how it works now, but because when we left, it was a very small community, and most of the time we know each and everyone of our seniors and juniors. And but now I think it's the community is growing and growing more and more, and it's a good thing. In a way, it's a good thing. I'm so happy that how our the seniors were wonderful, no doubt, but how our juniors are doing in the field. I'm really proud of them. I'm proud of Gulab. He is doing a wonderful job. His when he speaks in YouTube, I see his channels. He has like 200, 400,000 viewers. Wow, this is great. He's doing a wonderful job. So if you have any question, so I will be open to the question. Bhavit, I see there is a lot of chat. So
2 questions were there, sir.
so you can do one thing. I will not read the question. Can you read that to me?
Yes, sir.
Okay.
So there is a one question like how to choose the course in Coursera and why we choose like that particular course according to need of that or for you. Sir. You have done a course in Coursera.
Well, okay, I will
Like
just.
about the course, Coursera.
Yes.
So that was the question, sir. What was the like options to be taken in the choosing the course, online courses in course? Which option, like which courses are good? How to choose? Kind of.
Okay. So, Coursera is an open platform where I think in Coursera there is Cambridge who is giving, there is John Hopkins who is giving the courses. So what I was doing the courses that is relevant to my profession. For example, there were courses in exercise physiology, okay, which is very relevant to us, and I suggest that you do that. Then there are courses about diabetes. I done like 2 courses in diabetes, so which is absolutely it belongs to us. There are courses in obesity. There are courses in public health, depression. So there are like small courses, and they are not really. They will not consume a lot of time of yours, but they are very subject oriented and they have very good material there. So, but then I don't know if you are aware of that because these courses are normally free. But if you want a certified courses, then you have to pay a little bit of money, and then they give you the certificate. In EDX, is the same. For Oxford, it was about CBT, cognitive behavioral therapy, and it was about back pain, and it was the area of my interest, so that's why I did that. And, and even in NHS, it was about the pain management, and it was really something. My concept of pain is a little bit changed. I don't know because it's been long that I left the school, so I don't know how if the courses have been changed or something. But my perception about pain is a little bit changed after doing this course. It was a little bit difficult, but I loved it, and it's good. And I suggest that you should be doing that, or else if you want to ask something about these things, I will be open to answer that later. Yes. Any other question?
The next question from Shravanti. Sir, is doing masters in correspondence work. Can we gain knowledge and learn things even without going to college?
Of course. I think many of our seniors, they have done many things in correspondence, and you have to think that, because I don't know how the correspondence courses in India they work, but when you go for the online courses in Europe or US, because sometimes they have the online courses, like there is an online class from the lecturer, and then he will be asking you the question if you have a doubt. It's like a real classroom, and and the and the validity of the online learning is more now, because you have seen that many of the courses they move to online platform because of COVID. So more and more people are now doing this, and I think in future, this is the future. I think more and more people, because of their busy schedule, because of many things, they will be doing online courses. I think it's valid in few courses, in few things. For example, if you are studying psychology, if you are studying public health, if you are studying few things that you are not needed to go to the college. I'm not telling about the BNYS, because some quacks are giving the same course like BNYS, or I don't know what they call them. They give it by correspondence. Don't do that. It's not. And you have to oppose it all the time. They are not real. But the courses like psychology, where you can learn, but see that it should be coming from a valid university or a valid institution. Try to practice it. It's not just you are doing it. You have to practice it. If you're learning psychology, so try to to include that in your practice, and that's how you can excel. Anything else?
So we will wait for 1 or 2 minutes. If any questions are there, they can unmute and talk to you. Also.
Yeah, but yeah. So
One person, yeah, one
so
by one. If that is.
sorry.
One by one, they can unmute and they can talk to you.
Yeah, of course they can do that. And because nobody asked me, but I was because when I'm in Europe, so maybe you are wondering. You are still, few people are still student, but other people who are watching later in YouTube, or the people who are coming out in few years, so they may be wondering what is the situation of naturopathy and yoga in Europe. So I just wanted to clear about that. I prepared just for that. Okay. So when you see about naturopathy and yoga in Europe, so it's it's not considered together, right? It's both are different. So it's not, it will not be normal if the same person is doing yoga, naturopathy, and the same person will be doing yoga. So it's considered a separate entity here. So the naturopathy and yoga is not necessarily considered together. In general, both of them are well accepted, okay? So you can practice as a healer, or you can practice as a health educator and freelancing without any problem. And they consider it as a care outside the regulated framework, okay? So having said that, each countries, they have their own law about that. So this is a care outside the regulated framework. So as I told you, so you are not entitled to say doctor, that you are a doctor. You are not entitled, legally, you are not entitled to write doctor in front of you. You cannot diagnose, and you cannot interrupt any ongoing medical treatment. This is what I'm saying is, it's in the general practice. I'm not general practitioner there, remember. I have a private practice, so it may not be considered for me. So, okay. So in France, what we say, there is no regulation, there is no certification. Though there is chiropractic and osteopathy, which is recognized since 2002, acupuncture is practiced by a MD doctor, like a conventional medicine doctor. After doing some training, they undergo training, because acupuncture is a big thing. Many times they practice it, they believe in that. So they practice this, and mostly these people are the MD doctors. They underwent some months of training in acupuncture, and then they are practicing it. And freelancing is possible in both yoga and naturopathy, and anything, aromatherapy, reflexology, massages, and hydrotherapy, everything. Freelancing is possible. In Switzerland, it's regulated, and it's even covered by insurance, and it's in their national health scheme. In Hungary, it comes under alternate medicine, and it can be practiced freely. Okay, you can practice. If you are in Hungary, you can practice it. In Ireland and UK, you can practice without a title of doctor. And mostly when you practice it, you are practicing freelancing, or you are practicing in a big hospital with a multidisciplinary team. Okay, and you are recruited by a big hospital, and then you are covered by NHS. So in Ireland and UK, this is the situation. In Germany, it's important. In Germany, this may be the first country who has the license. So in Germany, naturopaths are licensed as Heilpraktiker. They are called Heilpraktiker. They have a national-wise licensing exams, and when you pass that, and you can work independently. And it is a widely accepted profession, Heilpraktiker or naturopath. They call it Heilpraktiker. In Norway, Sweden, and Denmark, there is a freedom in practice as a healer or health educator, as I told before. If you are there, you are free to practice. In Spain and Portugal, in many states, it's regulated, but they come under the Ministry of Labor rather than the Ministry of Health. But I mean, in Spain, yes, in Spain, in some states, they are in talk with the government to include naturopathy under the Ministry of Health, not the Ministry of Labor. And in these countries, they have the total autonomy in the practice. So you don't need the referral. Okay, you don't need the referral. You can write the prescription, you can independently open your cabinet, and you can practice in Spain and Portugal. In Italy, it is approved in some northern regions. In Belgium, it is recognized as a profession. I have been to US and Canada, so I can tell you that in US and Canada, it's regulated, and in some states it's regulated, but they are NDs, they are not BNYS. And I do not know if they have the equivalent. They don't give the equivalent, as far as my knowledge is concerned. If you are a BNYS, you go there, and maybe they will take some credit from your old studies or old syllabus, and then you can enter ND, and then you have, but still you have to finish your ND to be a naturopathy doctor there, and you can practice. And they are widely accepted. They are covered by by insurance, and homeopathy comes under naturopathy there. And you are mostly working as independent or as an integrated practitioner with other professionals, and you can even prescribe drugs there, including opioids with some restrictions. I think you can do that. And for yoga, I think yoga is not really regulated in many places. Even in US, if you can prove that you have these many hours of yoga education in India with this course, I don't think that you need to finish the minimum standard of RYT with what is the name, International Yoga Alliance. You don't have to do that. So if you can prove that you have already studied that, you can practice yoga. There are some schools which are widely accepted there. For example, if you say you are from Shivananda, they know that. If you say you are Bihar School of Yoga, they know that. So this is the situation in all over the world, in the world that I know. So this is what I wanted to add. So shall we take questions, Bhavit? There is something.
Yes, sir. There are 3 questions. Maybe it is covered anyhow, but I'll tell you, sir, what are the questions. From name is not mentioned. What type of license we require and how to get it in Europe?
Sorry. Can you? I will check.
Yes.
Wait.
What type of license we require and how to get it?
It's a question about. Okay, what type of license we require? Okay, the same thing I already told you. The problem is like in many of the European countries, the license is given to their citizens. It's not that, okay, I have a degree of BNYS and I just want to move in this country and practice. No, we cannot do that. Okay, because if you see the policy, the law of migration in many countries, in US, in Canada, because in Canada they have the point system, in Australia they have the point system. Point system is like, according to your profession, they give you the points, and if you have a particular point, you can legally migrate to that country. But no, but in those the list of profession, I don't see the naturopathy is mentioned. But if you are in this country already, if you are a citizen of this country, it can be like, it can be, it will not be a little bit, I mean, right to say, but if you are married to somebody who is citizen of this country, and if you are legally living there, so the list of countries I told you, you can practice definitely there. So, for example, I was telling about Germany. So if you are a German, you just write this exam, this license, because they have one course. So you have to write this exam. You have to pass this licensing exam, and you can practice. Okay. And in US it's the same. You have to pass the ND before. I don't think that for BNYS there is they will give you the license right away. But if you are in Europe, if you are already there, in Australia, in New Zealand, in US, in Canada, if you're already there, so you can definitely practice the things that I told you. And to go there, I think there are many ways. If you are the children of the citizen there, if you are sibling of a citizen there, if you go there as a student, okay, if you find a job and the employer is sponsoring you, so these are the ways you can go there. And once you are there, then you can find the way. You can do freelancing, or you can write the licensing exams, and then you can practice it. Yes. So can you please tell about London and Canada? I think I told. Can we practice in Switzerland? Switzerland, it's the same. I think that the license is open only for the citizens. Switzerland is one of the country which has the toughest immigration laws. So it is so in Switzerland it will be a little bit difficult to go there. But if you are there, yes, you can practice. There is somebody who is asking me about South America, like Ecuador. I really don't have any idea about Ecuador. Sorry, I've never been there. But maybe in internet you can do. No. I know about Costa Rica. I think Costa Rica, I saw few people they are practicing. but there is no regulation, but they are still practicing there. Yes, anything else? So I don't see Bhavit.
Yes, sir. There is no questions.
Okay, that's good. It's a good sign that there is no question, because, well, I told you it should be like a conversation. Okay, I would be happy if somebody is coming and they're telling their own experience, or if they, let's say, if there is somebody who is in internship or in the college, and they just want to tell their experience, so I would be happy to listen, right? So is there anything? You can just raise your hand and Bhavit will unmute you. Is
Yes,
that okay?
for sure. If they are ready, anyone.
Because no, because I told you, Bhavit, it's like it's long time that I never been. I I haven't been back to my college, so it was really inspiring to see all the students and the interns here. So it will be nice to listen to them. And and sometimes, like, you know, you have to change the way you see, because I was listening to Dr. Gulab's talk earlier, and he said it very well, because everything comes with the experience. For example, if I never knew before that I have to see the shoes of the patient, right? So when I was in New Delhi, so the person comes with that he has the pain in his back, in his knee, in his shoulder. So I was thinking, why in one side he has the pain? So then I realized that maybe there is a problem in his biomechanics. So I asked him to show his shoes. Okay. So when he showed the shoes, then I see that one side of the shoes has a lot of friction. So he was putting his biomechanics was not the weight, the distribution of weight was not correct. So he was walking on one side. Though when you see them walking, you don't realize that there is a problem. But when you see the shoes, so you see that. Okay, so you have to find these very minute details, and this will come with the experience. And I'm really happy that the person, I mean, the students, they are learning hard. They have a lot of exposure. Our seniors are giving a very informative webinars. I am whenever I have time, I am listening to them, and I'm really happy that a lot of students are following them, and I'm very sure about the future of our future generation. And you know what? This is the best time to be a naturopath, because until now, what we were doing, we were focusing more on non-communicable diseases, right? Hypertension, diabetes, obesity, this and that. But then we went back to the basics of naturopathy. What was the base of naturopathy was the seed is nothing, the soil is everything, right? And this is the thing which is proved now with the COVID-19. You see how many people, they have this infection, but they are asymptomatic because they have that robust immunity to fight that, and they survive. I have one cousin in New York, and he was telling me he works in the intensive care, and the room is full with the COVID patients. And when you see them, so he was telling that the most of the patient who died, they are not the patient like with this. It doesn't correspond to the severity of their disease. It's only the people who has a very good willpower, a positive outlook on their situation, on their life. They were successful to come out alive. And the one very healthy looking, but in ventilation, but they are hopeless. They do not want, they are frustrated. They have very negative outlook, very pessimistic. So they are the one who succumb to this infection. So you see, we as a naturopath yoga doctor, our role is to build up the positive outlook of the patients. And this is what are helping the patient to fight even a deadly disease. It's not a deadly disease, it's just another infection. So it's helping them to fight. So our responsibility is more after post-COVID or even during this, because you have seen like many seniors, they are working in naturopathy hospitals, they are working with COVID patients in India as well as in Nepal with wonderful results. So I'm very encouraged to see what we are doing right now. And I think this is the best time to be a naturopathy and yoga doctor. So if there is nothing, I think we can just stop here. Is there anything?
There is a question, sir. It came privately, sir. Like it came to me, so I'll just let you know. If our degree is not valid in any countries outside, so what we called as a therapist or something like that.
Sorry.
If our degree is not valid outside, so what we called as a doctor or therapist.
It depends upon you. If you, well, what I'm saying is not to be called as doctor. It's only the legal thing. If you sign a paper, then you don't write a doctor. But for your patient, you're a doctor, right? Because you have done this, so you are a doctor. They will call you a doctor. It's only when it comes to the legal part. Okay, so you are not considered in few countries. And when you do the freelancing, so I don't think that, because in Paris, I live in Paris, so in Paris there are many cabinets. They don't call it clinics, so they call it cabinets. Okay, so it is a cabinet. Even for dentists, they call it the cabinet of a dentist. Okay, so it's a cabinet of a naturopath. Okay, so your profession is protected by the Ministry of Labor because you pay the tax, right? So it's your profession, and in this cabinet, whatever you are doing, it's between you and your patient. Okay, so if the patient is comfortable, so it's up to you, because you know our basics are very strong. We have studied almost everything what a doctor should learn. So you have to be confident on what you are doing. So, and then you don't need to be you are not obliged to have the title, right? So it's between you and your patient. If they call you doctor, it's fine. If they don't call you doctor, if they call you yogi, sometimes they call me yogi, so I'm fine with that, right?
So that was the last question, sir, from the people who have attended this session. And thank you for your time, sir, which was very great as a student, as an intern, to learn many things from you. And I hope everyone learned from this session from starting to end. And that is the most important part, the experience, what we should understand as a
Yes.
student or as an intern. That is the most important thing which was given from you, sir. So thank you so much, sir, for the
Thank you. Thanks a lot, everyone. Thanks for listening to me patiently,
thank you,
and
sir.
hope
And
to see you around.
yeah, thank you.
Thank
Thank
you.
you, everyone. We'll end this session. Thank you. Namaste, sir. Namaste. Thank you.
Thank you.